So this is Dr. Wells from Wells Medicine, and I wanted to discuss another of my favorite kinds of therapy. I really love dialectical behavioral therapy. So dialectical behavioral therapy is actually one of the newer kinds of therapy. It was created in the 80s by Marshall Linehan, and dialectical behavioral therapy is very common in the community. So often if you're in an IOP or intensive outpatient program, or if you're in a partial hospitalization program, dialectical behavioral therapy is one of the most common kinds of therapy done in those programs. And you'll see DBT a lot in typical talk therapy. DBT I find to be most useful in acute situations. So situations where patients are really in a traumatic moment or kind of in very severe anxiety, severe depression, and severe panic. DBT is often also thought of as a kind of therapy that is very particular for borderline personality disorder, which is a very hard personality disorder to treat. Not a lot of therapies work for it, and DBT is one of the few that does. DBT, I think, has a lot to say for, those acute instances where maybe something a little slower like cognitive behavioral therapy, where you're having to kind of step back from the situation and look at your thoughts and do a lot of very, detective work on your own. DBT is really in there with you when you're having a panic attack or when you're having, severe symptoms. DBT is very focused on grounding and on they don't call it distraction, but I think of it as a form of distraction where you are really in the present moment. So it's got a lot of techniques that help to bring you down and out of your thoughts and into your physical body. So for example, putting your hands in ice water or taking your shoes and socks off and putting your feet on the ground. Doing an exercise where you're hearing a certain number of things, feeling a certain number of things, tasting a certain number of things, seeing a certain number of things, to bring yourself out of your head and into your physical body, which can really reduce that sense of being on a cliff's edge or crisis or urgency. And I think that's very helpful to allow us to get some space. And then in that space, you can do some of the more thoughtful therapies like CBT or ACT. But DBT, I think, is brilliant in a crisis. Some of the ways to access DBT, again, you have the IOPs, you have the partial outpatient programs. Marshall Linehan herself has written some books that are available publicly. One of my favorite podcasts, Therapy in a Nutshell, has some DBT exercises that she goes through in her podcasts. To kind of work through some of the DBT exercises. And there are some free printable PDF workbooks on DBT exercises that are easily accessible online. And we link to some of them on our website as well. So again, DBT is one of my favorite kinds of therapy. I really think about some of its exercises first in a crisis or in a severe situation to kind of bring us back into our body, bring us out of our head, bring us back into the moment and the present day, and kind of get us out of the future, out of the past. And allow us to do some of the more thoughtful, little bit more difficult exercises of cognitive behavioral therapy or acceptance and commitment therapy.